Hello, my name's Tracy Bruce. I'm Head of Patient Experience at Northumbria Healthcare. I'm coming to you from a very hot hospital room, so you will notice my rosy cheeks. We're absolutely delighted to have been shortlisted for the PENNA Awards for strengthening the foundation, and I'm really thrilled to be able to share the privilege that we've had to work with the Syrian refugee families within Northumberland. So Northumberland has a significantly lower BAME population, so that's Black Asian minority ethnic population, in comparison to the England average. And one of our observations were that we perhaps had less visible role models, community role models, and we wanted to do some community consultation to find out if there would be a benefit of us working on developing a role models programme so that we could work in partnership to help improve access to our healthcare services. And also because as a trust, we're very committed to the equality and diversity work that we do throughout the year. One of the things that we found whilst doing this consultation is some quite startling prejudice that were evident in the community, and we used this as an evidence base for funding. So by applying for a small amount of national lottery funding, we developed two. Oh, sorry, there's some feedback on the thing there. We developed two role models programs and began working on them, and the focus for me was to work with the Syrian refugee community who had recently resettled within Northumberland. So as a community, what we found was the Syrian families were not really accessing healthcare services in the way that we'd hoped for. And so we developed this role models programme. We went along with this, what we thought was a great idea, which would be a structured programme. We would sit down, we would share learning, and then have visible people in the communities. And the families just said, no, that's not what we want at all. And so we listened and we said, what is it that would work best for you? And they said, we want to create a video. And so we started to explore the reasons behind that. And they shared with us that when they'd arrived in Northumberland in England, they hadn't felt safe at all. And so, wow, no wonder they weren't accessing healthcare services if they didn't feel like their basic needs were being met. They'd been given a lot of misinformation in the refugee camps. So because there was a lot of jealousy that families were moving on, they were told awful bits of information like the healthcare would be very poor, they would sleep on the floor with other families, their children would be removed if they weren't intelligent enough. So they were very, very fearful of us as an organisation when we started to do that work. So we produced the clip with the intention of showing other families when they arrived in Northumberland that it's a safe place to live, that we have excellent healthcare provision. We want to work together with them to help their children grow and flourish. So that clip was a really important piece of work that we were involved in. And then the families asked after that, can we host a conference? So we had the first Northumberland Community Culture Conference where families stood up and spoke about the differences in terms of healthcare in Syria to what it is in England, their journey about arriving here and how proud they are of their culture. They also invested a lot of their time training us as healthcare professionals, letting us know what some of the barriers were in terms of accessing our services, which was an invaluable experience that we had had. So this is the film clip, which I'm hoping we'll be able to see. You will also see a very nervous Tracy Bruce on the video clip as well. But we just wanted to share this with you to show some of the examples of how the families had portrayed how they found Northumberland.
In 2015, Prime Minister David Cameron announced that 20,000 Syrian refugees would be given accommodation in the UK. The programme was set up to accommodate that promise and bring the families across from Syria.
جيت نورثمبرلاند لأني كنت ببلدي غير مستقر أمنيا. الحياة كانت كثير صعبة والقذائف مما سبب زار إلي ولعائلتي.
يعني كمعيشة حياة صعبة.
حياة صعبة وما كانوا الأولاد بالمدارس، ويعني لحالي كنت عرفت وأجارات غالية وأكل غالي ومعيشة غالية. نحن ما بنغادر بلدنا بس إنه حرب يعني ما ضل حد بسوريا يعني على.
We meet our families straight from the airport and take them to their new homes. We offer them fully furnished accommodation, we provide welcome packs, we arrange access to all the medical care that they need and also provide school places for their children.
والله أول ما وصلنا استقبلونا أحلى استقبال، يعني احنا تفاجأنا، عن جينا لهون تفاجأنا.
لأن الحكي غير الشوف.
Community Culture Northumberland is a really exciting programme that we're delivering. It is about bringing people together in the community so they feel involved and connected and so that they know Northumberland is a happy and safe place to be. The programme is for the Black Asian minority ethnic community. In particular, we've done some work with the Syrian refugee families, which has been fantastic. It's about helping them to understand the fantastic services we have available so we can help improve their healthcare and so we can make sure we help them to be happy and healthy.
This programme is helping families lead healthier lifestyles by providing programmes about healthy living, healthy eating, gaining more physical activity, taking them on specific outings such as Wet and Wild where they've gone swimming for the first time.
It's important that we provide services like this so that our Black, Asian, minority ethnic communities know that we have a variety of healthcare services that they can access. It's important to us that new refugees coming into the country know that we will support their health, that we will ensure that we respect their cultural values and that we will help them to become happy, healthy members of our Northumberland community.
الولادة كانت مجانا والرعاية الصحية للبيبي أول ما خلق كل شوي تجي النيرس تفحصه من ناحية أي فحص مجانا. الحفوضات بالمشفى، الألبسة للبيبي، الرعاية الصحية للبيبي وللأم، الأدوية.
It's important to provide support for the families when they first arrive because they are very conscious that they feel alone and isolated. The work that we do helps them really feel part of their community and connect with their neighbours and the local society around them. We often say to our families, don't worry, you're not the first to arrive. We have other people we have helped who have settled in and we're here to help you as well.
Welcome to Northumberland!
Oh, and it fills my heart with so much joy when I see that film, to see some of the families we've worked with and to build that rapport where they felt they could trust us, which was really important because we did also have some laws in this programme as well, where there was a national hate campaign, and I can describe that in more detail if anyone has questions. But they came to us and told us about this worry that they had, and they said because we'd worked with them and they had seen this lanyard, the NHS lanyard, they know they could come to us and get support. So we organised a coordinated response to help the families move into an area for a short space of time where they could feel happier. And if you go to the next slide, this is where we went. We actually went to a local woodland area and set up a campsite, and we sat around a fire and we shared stories and sang and shared food, and it was just a lovely experience to bond us all together and just to show that the NHS is there for not just supporting physical health needs but also emotional health needs as well. So next slide, please. So building on that, just very quickly, we started to be involved in other programme work. So we got involved in some public health activities as well. So knowing that some of the Syrian families had poorer health because of the really sad experiences they'd had in refugee camps, we looked at physical activity. So we had the first Syrian football team, El Namur, which was brilliant. There were some cultural considerations that we needed to be mindful of, and just that general importance of promoting physical activity. Next slide, please. This is another example. So from that, we just kind of went from strength to strength, and the family started to get involved in weight management programs, healthy eating, some smoke and cessation work, and the alcohol awareness was more of a wider awareness of what might happen in some of our communities. Next slide, please. So since then, we've got 15 very well established community role models, very strong, going and giving local talks about experience healthcare, lots of great stuff. Families are going really strong as well. They're integrated into the community, and the children are just really, really shining at school.